How's everything been? How have you been feeling?
Feeling wonderful.
Edward is one of 15,000 D.C. residents living with HIV.
They think it was an exposure.
He tested positive 29 years ago.
Well, actually, I thought I had venereal disease, STD, and it was syphilis. This is what I contracted. When they did my blood work and everything, they found out that I was HIV positive.
According to a report released by the city this week, Edward is not alone. 3% of Washington residents have either HIV or AIDS, the highest infection rate in the nation. It's greater than in some parts of Africa and qualifies as an epidemic. The city's HIV/AIDS Administration Director, Shannon Hayter, says calling it an emergency is not enough.
This is an urgent and important and a long-term problem that needs an urgent and important and a long-term solution. I actually think calling an emergency sets the bar too low.
Whatever happened in the past, it has stopped.
It stopped.
Yes.
According to the report, the virus is being spread by men having sex with men, heterosexual sex, and intravenous drug use. The African American community is suffering the most. African Americans account for almost 8 out of 10 cases of HIV and AIDS. 9 out of 10 women with HIV/AIDS are African American. Edwards says people have become careless.
And then when you're caught up in the moment, alcohol and drugs, you're not thinking about condoms, you're not thinking about safe sex, you don't really care about it. All you care about is being with the person that you're with. And see, a lot of that goes on.
Some researchers say African Americans may have a genetic susceptibility for HIV. Experts say a major part of prevention is getting tested. Promoting condom use and needle exchange programs is also important. In Washington, 30% of new HIV cases can be traced to intravenous drug use. Chip Lewis is a spokesman with the Whitman Walker Clinic, an HIV/AIDS treatment center.
There's no magic bullet for it because you're talking about issues around stigma, discrimination, sexuality, sexual behavior, drug use, poverty. I mean, it's a very complicated situation that's really driving the whole HIV/AIDS epidemic in D.C. So you can't just attack one aspect of it. You really have to work on all the aspects of it.
Well, you're a model patient. I mean, the most important thing is just taking the medications. So.
Edward's drug regimen has decreased the amount of virus in his blood to undetectable levels. For many living with HIV or AIDS, advances in treatment have dramatically improved their lives. Jeff Swycord, VOA News, Washington.